Diane asks, is there a connection between how sugar is consumed by humans, large amounts of sugar like in soda, and pancreas cancer?
You may be a fan of soda, and I am also. And being a pancreatic cancer oncologist, I have never seen any link that puts the two together, consumption of large amounts of sugar and diabetes as such. Certainly, large amounts of sugar is not good in terms of the excessive calories, weight gain, etc. But a direct relationship between a lot of sugar and pancreas cancer has really never been established. But again, I'm not trying to encourage you to have lots of sugar and calories. That's not good either.
Donnell asks, what are researchers doing for the neuroendocrine pancreatic cancer? How long could you have neuroendocrine pancreatic cancer? Are they trying Y90 from Switzerland here in America?
Neuroendocrine tumors of the pancreas are an interesting group of cancers or diseases. As you well know, they constitute less than 5% of the patients who we call pancreas cancer patients. So it's not a common disease. But the interesting thing about them is the following. In the majority of the patients with neuroendocrine tumors of the pancreas, the course of the illness is very much different than the common variety pancreas cancer. The common variety pancreas cancer, we call it an adenocarcinoma. The neuroendocrine tumors come from a different cell origin within the pancreas. And they tend to have, not all of them, in general, a more indolent or a more slower course in its development. The other interesting thing about these tumors is that some of the patients, because the disease is so slow, they don't even need a treatment. And again, like pancreas cancer, it can go to the liver. And when it goes to the liver, there are some treatments nowadays available. And in fact, we're seeing more and more newer drugs being available for this type of cancer. Recently, over the past 2-3 years, we had several drugs that have been shown in large clinical trials that they can somehow interrupt the progression of the disease. So there are drugs for it. The treatment that you're asking me about, the radionucleotide, unfortunately so far hasn't been used in this country in the sense that using it tagged to a certain drug that targets a receptor in the tumor. But the yttrium-90 treatment is also available here in a different format that can be used in patients with where there's spread of the liver to the liver metastasis. So I wasn't sure exactly which format or which type of use you were asking, but there is yttrium-90 treatment in this country. It's available. If it's the one which targets the somatostatin receptors, that's not available in this country.
Christina asks, how do you know the difference between neuroendocrine and exocrine? They've told my partner that they have just pancreatic cancer, stage 4, and she has a very elevated CA19-9 count. She's going on her 6th Gemzar treatment, and they haven't mentioned any other type of treatment, no surgery, as it's already spread to the liver and peritoneal cavity.
The difference between the two types of cancer can be demonstrated looking at scans, looking at blood tests. For example, CA19-9 does not go up. It doesn't go up really that high in patients with neuroendocrine tumors, whereas it can go up to levels like what you have here in the exocrine, which is the adenocarcinomas. The ultimate difference that we rely on is also based on what we call tissue diagnosis, where you have a sample of the tumor, you look under the microscope. And that's always how we diagnose cancers, and that's always how we type or classify cancers. That's the surest way of doing it, and that's the gold standard. So that's the best way of making the difference. In terms of the treatment, Gemzar alone, again, this is a treatment option that has been going on for almost 15 years for this disease. Nowadays, as I mentioned earlier, we have other drugs that we can add or substitute. At this point in time, if the Gemzar is keeping the disease stable, one would continue on it, but when the time comes when the tumor cells will become immune or resistant to the Gemzar, then one can go to other chemotherapy drugs available. And again, the number of these drugs available has increased over the past 2 years.
And the last question was from Michelle, and she asks, are there any current clinical trials, advances in medicine that look promising to help people live longer, more productive lives with this beast of a disease?
There are a number of clinical trials currently ongoing, and the clinical trials that you really want always to start off with is what we call phase 3 clinical trials. Phase 3 clinical trials come after phase 2 trials. Phase 2 trials identify some interest or a signal that is of interest for a drug. And then that drug goes into what we call a phase 3 trial, which is a more definitive way of trying to find out whether that drug is working or not, in addition to the existing standard treatment. As I mentioned earlier, there's a drug called nab-paclitaxel, also known as Abraxane, its trade name. That's going through a phase 3 clinical trial internationally. That's a drug of interest. There are newer drugs that are being also tested against some targets. Some of these drugs don't even have full names yet, but the targets, for example, hedgehog inhibitors, targeting a target called hedgehog. There is IGF-1R inhibitors that are targeting an insulin growth factor-like receptor pathway. And there are several others, but we are also working on several clinical trials at the national level, trying to prove and confirm some of the findings we have seen in European trials. So there's a number of trials that are going on in the country and internationally, and it's always worth asking your oncologist or even going to the website, which is by the National Cancer Institute, that will have a list of all the clinical trials open in pancreas cancer. I am Philip A. Phillip. I'm a professor of medical oncology at Karmanos Cancer Institute, and I'd like to say the following: get on the road to cure with us.
Thank you. Thank you very much, Doctor, for spending your time with us today.
I appreciate it. Again, thank you very much.